hand hygiene is extremely important before and after any direct patient contact and between patients, whether or not gloves are worn. It has to be done immediately after the gloves are removed and before handling an invasive device. Hand hygiene also is important after touching blood, body fluids, secretions, excretions, etc. During patient care itself, when moving from a contaminated to a clean body side of a patient. For example, he has conjunctivitis in one eye. You examine that eye, clean your hand, and then examine the other eye. Hand hygiene is also important after contact with inanimate objects in the immediate vicinity of the patient. The personal protective equipments include gloves, masks and respirators, and disposable aprons and gown. Gloves are to be worn when touching all these body fluids, blood, secretions, etc. And it has to be changed between tasks and procedures on the same patient after contact with potentially infectious material. For example, with conjunctivitis. It has to be removed after use, before touching non-contaminated items and surfaces, and before going to another patient. Perform hand hygiene immediately after removal of your gloves. So you need facial protection. See, you're not really careful about it. About a month back, I was operating on a lid tumor. The blood just spurted into my eye, so I was really scared. But already HIV, HBsAg had been done for that patient, so I was at peace. So facial protection, including goggles and all, you have to really consider while operating. Not for cataract, but when you expect blood to spurt. Gown is to be worn to protect skin and prevent soiling of clothing during activities that are likely to generate splashes, sprays, as before. Remove the spoiled gown as soon as possible and then perform hand hygiene. All of us healthcare providers are at risk of injury by sharps, be it from the needle, which is used to give injections, or suture needles and other sharps. And now that mostly we have gone to topical anesthesia, the use of injection has been minimized in ophthalmology, but still when you give perivalvular anesthesia or when you give medicine injection medications, you will be using them, and you have to be extremely careful when using them, and also when cleaning instruments which are sharp, and extreme care has to be taken in disposing used needles and other sharp instruments. Make sure that this doesn't harm the recipient, doesn't expose the health worker to any risk, and does not result in waste that is dangerous to the community. You have needles, you just throw it away. It's not just the cleaning staff who are at risk. Whoever is out, the infective material stays for a long time on those needles, and anybody gets a prick from that, definitely the infection can get transmitted. Lot of pathogens can be transmitted by blood. Most importantly, hepatitis B, hepatitis C, and HIV. Hepatitis B and hepatitis C require a very minimum amount of blood for transmission of infection, and it remains alive for months. The amount of blood needed for transmission of HIV is a little bit more, 0.1 ml, and it remains alive for a few hours or days. So it's less infective than hepatitis B and C. Needle stick injury, it's always a real risk. 80% of it occurs during recapping. So recapping should never be done ideally. And if at all you're planning for recapping, it has to be a single-handed technique. Respiratory hygiene and cough etiquette is important in a hospital setup. A patient with cough and all has to cover their nose and mouth while coughing with tissue and mask, and each and every hospital setup should post visual alerts at the entrance to the healthcare facility, instructing the persons with respiratory symptoms to practice respiratory hygiene and cough etiquette. Environmental and patient care equipment in an opthal OPD setup. We'll be explaining that in the video that follows our presentations. See, these are the areas that an infected patient can infect. See, slit lamp, AR, tonometer, trial set, door handles, countertops. So all these have to be cleaned properly so that there is no cross-infection. Linens have to be transported and processed properly to prevent skin and mucous membrane exposures and contamination of clothing, to avoid transfer of pathogens to other patients or to the environment. And last but not the least is the waste disposal. You have to ensure safe waste management. You have to treat waste contaminated with blood, body fluids, and all in accordance to the local regulations. Human tissues and laboratory waste that is directly associated with specimen processing should also be treated as clinical waste. Discard single-use items properly. See, I told you about the sharps. It comes under category number 4 of the waste, and these have to be disinfected before it is shredded or mutilated before disposal. The others would be tubings, catheters, etc. These also have to be disinfected by chemical treatment or autoclaving or microwaving, then mutilated and shredded, and then disposed. See, all these that I've just gone through in my presentation would be explained beautifully in the video being presented by Dr. Rajiv. Thank you.